Hello. Hi, everyone. This is Stephen Judge, clinical naturopath in Sydney, Australia. I wanted to make a live video tonight just talking about something that I find myself repeatedly talking about with clients on a weekly basis, with family, with friends. I guess because it's something that is so prevalent and related to so many niggling chronic health symptoms and conditions that I see people for all the time. And it's this term called leaky gut. So, leaky gut is all over the internet and the blogosphere these days. It's touted as one of these things as being the cause of so many different conditions, from everything from food allergies and intolerances, behavioral disorders in children, chronic gut issues, inflammatory issues like arthritis and autoimmunity, mental health conditions. And there's definitely merit and great clinical research to back up these ideas, but we first need to take a step back and understand exactly, well, what is leaky gut? Because the term itself, leaky gut, might sound kind of wishy-washy, but leaky gut syndrome, it is in fact a term used to describe what is known in medical terminology as increased intestinal permeability. So for something to be permeable basically means having pores or openings in it to allow the passage of something through it, like a liquid. So I guess with the gastrointestinal tract, first just discussing, how does digestion work? So I guess we start with the mouth. We chew our food. We swallow our food. It travels from our mouth down the esophagus, down to the stomach, where in the stomach we should have really strong acid and other digestive juices to break down our high protein foods and our other macronutrients, so carbohydrate and fats. And then once digestion has occurred in the stomach for a few hours or so, then the stomach slowly empties this broken down food into what is known as the small intestine. So the small intestine is a really important part of our digestive tract, because once the food reaches the small intestine, this is where it undergoes some even further breakdown of food. But it's where basically we absorb all of the nutrients from our food. So this is where we absorb all the vitamins and minerals. So clearly understanding this about the small intestine, that this is where we absorb all the nutrients from our food, understanding this, the health and integrity of our mucous membrane tissue, the lining of our gut wall of the small intestine, the health and the integrity of that is pretty important, because at the end of the day, if we're not digesting and breaking down our food and we're not absorbing the nutrients from that food, our cells, we're not getting the nutrients from that food delivered to the cells in our body, and there's a range of downstream effects from that happening. So you can have the best diet on paper, you can be taking a bunch of really expensive supplements, but if your digestive function is poor and you have increased intestinal permeability and your small intestinal wall is not in an optimal state, you're not absorbing anything properly, this sets up the stage for a whole range of obvious downstream problems. So technically, we're not exactly what we eat. I prefer to educate a lot of clients I work with that we are in fact what we digest and absorb, essentially. So healthy intestines are actually naturally permeable. They need to be, so that they can selectively allow these tiny particles and vitamins and minerals to flow through the lining of the gut and get into the bloodstream. So I guess the operative word here when talking about leaky gut is there's increased intestinal permeability, which basically means that instead of the lining of the gut wall being healthy and strong and selectively allowing these tiny particles to flow through the lining of the gut, what's happening with leaky gut is much larger undigested food molecules that shouldn't be getting through that strong wall. They do get through. And when they do get through and get into the bloodstream, this causes an immune system reaction, because essentially the immune system is sensing something foreign in the bloodstream, and so it elicits an antibody response from our immune system and causes inflammation. So there is something known as tight junctions in the lining of the gut. So their job is to prevent the passage of these large food particles and any kind of toxins to get through the gut wall. And so these tight junction proteins in the lining of the gut wall, excuse me, are regulated by a protein called zonulin. But when this zonulin protein becomes triggered repeatedly, many times due to very poorly digested food, gut inflammation, food intolerances, gluten is known to directly, constantly increase zonulin production in leaky gut. So as we are constantly eliciting zonulin because of all these factors, we're opening up much larger spaces in the lining of the gut wall than it's used to doing. So these larger food particles can get through and drive this inflammatory immune response. So this discovery and research around zonulin and intestinal permeability was really pioneered by a professor called Dr. Alessio Fasano. So anyone wanting to dive deeper into this should definitely check out his work. And so I guess this activated immune response, when it produces these antibodies in response to these perceived foreign things in the bloodstream, driving all this systemic inflammation. So this can manifest as many different things depending on the person. So some people, due to this, experience a lot of physical pain and inflammation. Other people experience chronic allergies. Other people, eczema and other inflammatory skin conditions. You might get the classic gut symptoms like bloating and abdominal pain. This can drive mental health symptoms. We're understanding a lot more now about the gut and brain connection. So it really does, this increased intestinal permeability and leaky gut really does have a huge effect on our overall state of health. But it will manifest differently in different people depending on their unique susceptibilities. So conditions that we know that are directly linked with increased intestinal permeability are celiac disease, so allergy to gluten, Crohn's disease, and ulcerative colitis. So addressing the impact of leaky gut in these conditions is particularly important because leaky gut can also manifest in the large intestine or colon, where inflammatory bowel disease tends to be implicated. A lot of people ask me with leaky gut, is it true that what happens, that bacteria are getting through the gut wall and into the bloodstream? I think what's more commonly going on here is there are a particular kind of bacteria in our gut microbiome. There are many different kinds, but there's a particular one, and they are known as gram-negative bacteria. And these bacteria are important to be aware of because they produce something called lipopolysaccharide, or LPS for short. And these bacteria that produce this substance called LPS, they're known as endotoxins. So they're toxins that are inside a bacterial cell that these bacteria can release, and they are directly inflammatory to our gut wall. So it can also be that these LPS toxins can also pass through an increased permeable gut wall, and these endotoxins are a huge problematic driver of a lot of systemic and widespread inflammation due to the leaky gut and the triggering of the immune system. So I would say in much more serious cases, there will be cases where bacteria do translocate from the gut and into the bloodstream, and this can ultimately lead to infections elsewhere in the body. In very extreme circumstances, it could result in sepsis or a blood infection, which you don't want. So undigested food particles and these bacterial endotoxins, so these LPS endotoxins, tend to be really key drivers of leaky gut, as are sometimes bacteria actually translocating into the bloodstream where you don't want them to be. So this is all great. This is kind of what's going on with leaky gut on a physiological level, and how it's driving this inflammatory immune response. But I guess what I get asked all the time is, well, how does someone get this? Like, how does someone develop this increased permeability and this leaky gut syndrome? It's a great question, and I wish there was a really simple answer. We could easily identify kind of the one thing and get rid of it. That is a very old school conventional medical idea, that you can find the one cause of something and eradicate it with one medication, which is lovely in theory, but in reality, this approach typically involves a lot of side effects and is a band-aid. So we kind of need to take a step back and look at the multifactorial nature of something like this, particularly when it's linked with chronic kind of niggling health conditions and symptoms. So there's a combination of potential underlying factors that can cause someone to develop leaky gut. I guess it's really important to understand and enter this also from a place of understanding that I personally wouldn't really talk about leaky gut as if it was a disease or a condition. I think this is where medical doctors get very hung up, and it's kind of woo and don't want to know about it. It's better understood as a symptom. It's an underlying symptom that people can develop progressively over time due to a number of factors. It doesn't just pop up out of nowhere overnight. It's more of an underlying symptom in the body that is directly linked with a wide range of very specific medical conditions, which is why it's important to address. So I'll briefly lay out the key things that can develop into leaky gut. And I guess I'll start with something seemingly obvious and kind of cliche, but still very significant, which is stress. So this is important because when you are feeling very anxious or you're very stressed, this constant activation of our inbuilt stress response and the flood of hormones that we produce when we elicit this. So for example, cortisol, the infamous stress hormone, this cortisol is directly inflammatory to our gut wall. And on top of this, cortisol and other stress hormones, they shut down our digestive function overall. And so this leads to issues down the track, which are further drivers of leaky gut. So chronic anxiety and chronic unmanaged stress, and I guess I'd work in here poor sleep quality as well, and insomnia, this has a huge driving effect on developing leaky gut. Because I guess if you think about it, like, the stress response is a primal inbuilt mechanism that we're meant to have, that's triggered when we are in direct danger, when we're under threat, and we need to flee from danger. So when we're in this situation and we elicit the stress response, blood flow is diverted away from our gut and digestive organs, because digestion isn't so important when this is going on. So blood flow is diverted away from the gut. We're not making strong acid in our stomach to break down food. We're not making digestive enzymes. Our gut motility gets affected, so our bowel movements. You're in this state of fight or flight, and digestion isn't important. So when we're eliciting this response, I guess in the modern world, kind of on a constant, with some people, a very constant daily basis, this just leads to very poorly digested food, malabsorption, eventually a lot of gut inflammation, and I guess a downstream effect of all this is increased intestinal permeability. And so while I'm mentioning the link between the stress response and leaky gut, I guess this really ties in with leaky gut and its role in mental health, because what studies now discuss is that the way in which the gut microbiome affects central nervous system disorders, so whether that's anxiety, depression, autism, is that inflammation in the gastrointestinal tract directly stresses the gut microbiome through releasing these inflammatory chemicals. And so all these inflammatory chemicals combined with this increased permeable gut wall, it allows these inflammatory chemicals to travel systemically throughout the body, which may, in some people, increase the permeability of the blood-brain barrier. And this subsequently directly influences brain function. We also know, it's been known for a while now, that a standout biological feature of depression is dysregulation of this hypothalamic pituitary adrenal axis, the HPA axis. So there is this dysregulation of the stress hormone network in the body. So this cortisol stress hormone becomes very dysregulated, and this directly not only affects mood because it's highly inflammatory, but it also directly increases intestinal permeability. So yeah, very fascinating, interesting stuff. So stress is a big kind of key driver of leaky gut. I guess the second major one, which we can then break down, is something called dysbiosis. So dysbiosis basically means microbial imbalance. So an imbalance of the so-called good and bad bacteria in our gut in favor of the bad. So bacteria in the gut, they all have important roles to play. So I guess it's not usually so much an issue of good or bad. Issues start to occur when particular species in the gut grow far too much relative to others which might be very deficient. So it's all about balance. So for example, this type of bacteria I mentioned before, these gram-negative bacteria, they have important roles in the gut, but when they overgrow in certain amounts and they're pumping out very high amounts of these LPS endotoxins, they drive a lot of gut inflammation and leaky gut. Dysbiosis is so common these days. I rarely work with anyone who doesn't have a level of it driving their gut issue, their chronic inflammatory skin issue, their respiratory issue like asthma, their food allergies and intolerances, hormonal issues. I would include in their endometriosis, their mental health symptoms, and we kind of elicit this upon some very thorough case taking, just getting a good case history and timeline and seeing where their gut may have been drastically affected, but also utilizing gut microbiome testing. We always generally uncover some level of gut microbiome disruption and dysbiosis. So if it's so common and such a prevalent thing that is driving leaky gut and all these related conditions, I guess we need to take a step back and go, okay, well, if dysbiosis is so common and a key driver of leaky gut, well, what causes dysbiosis? So to answer this, we need to take a step back and reflect on this, and there's quite a number of things which can contribute to gut dysbiosis, this imbalance of bacteria in the gut. So I guess I'll just lay out all the major ones. The first kind of really obvious one is antibiotic overuse. Overuse, or even to be honest, one course of very strong antibiotics can drastically disrupt the gut microbiome. And I mean, bacteria are smart. We're in a bit of a crisis where we are becoming resistant to antibiotics. So people get sick, they're resistant, they get prescribed a different antibiotic, they feel momentarily better, they get sick again, they're resistant, they get another antibiotic. It's just this vicious cycle, and we are constantly just driving further and further gut dysbiosis, which essentially will lead to leaky gut. So antibiotic overuse is a huge one. Another one is parasitic infections, so parasites, bouts of gastroenteritis, or other gut infections, particularly when people travel. I can't count the amount of times that I've worked with someone where the onset of their symptoms, or at least the point of time where their symptoms got dramatically worse very quickly, was after experiencing a gut infection or a parasite or some kind of gut pathogen. And this is also commonly what causes people to have post-infective IBS. So, they haven't been the same since this kind of gastro gut infection episode and don't have a clinical diagnosis of a more serious gut condition, but they have kind of what appears to be IBS or very poor digestion. So yeah, infections, parasites, gastro can be a big instant driver of someone developing dysbiosis and subsequent leaky gut. Another important one to discuss is cesarean births. So this is really important to consider because of its impact on the microbiome of the baby, because we know that during a natural vaginal birth, specific bacteria from the mother's gut is passed on to the baby. And so essentially these gut bacteria stimulate the baby's immune response, and this transmission of bacteria, this is missed in children who are born via a C-section. So they're essentially missing out on the colonization of these bacteria that it will significantly affect the short and long-term course of their health. So a lot of these kids generally, they grow up being severely allergy prone, eczema prone, have very poor immunity, have a lot of food intolerances. And, it's not to make anyone feel guilty about having to deliver their child via a C-section, but in the context of if you wanted to improve a particular health symptom or condition, it's important to know this about someone's medical history, because then we can really understand and know that we might need to target quite specifically on addressing gut dysbiosis and maybe do some testing to get really specific with that. High blood sugar levels and insulin resistance, metabolic syndrome is directly linked to driving leaky gut, and it's also that is intricately related to the cortisol connection, so the stress hormone. As I touched on before, having low stomach acid and enzymes can lead to gut dysbiosis, this classic symptom of having low strong stomach acid will manifest as chronic bloating, sometimes some pain and cramping, particularly if these symptoms manifest very quickly after you eat. High protein and very high fat diets are a potential side effect. A potential side effect of these diets is gut dysbiosis. So I guess that essentially depends on whether or not you're compensating the very high protein and high fat diet with plenty of plant-based prebiotic rich foods. I have seen a lot of people go on the keto high fat diet, and some people do brilliantly and even their gut health shifts. Other people go on it and their guts get ruined. So I guess like anything, it's a very individual, but I guess anyone going on a high protein or high fat diet just needs to make sure they're eating plenty of plant-based foods and even considering like prebiotic supplements just to ensure they're really feeding those beneficial gut bacteria. Refined sugar and carbohydrates massively contribute to developing dysbiosis, particularly because people eating a lot of those foods, their diets are devoid of, again, a lot of plant-rich foods, beneficial fibers that beneficial bacteria ferment in the gut, which create anti-inflammatory compounds. So just the Western diet in general can lead to dysbiosis. Alcohol is a huge one. Alcohol just is awful for the gut, full stop. Sorry, everyone. If you have existing food allergies and food intolerances, this is a tricky one because it's a bit of a chicken or the egg situation. People have some major health episode and then they develop food allergies or food intolerances. And so I guess when you have gut inflammation and you're eating foods that you're allergic or intolerant to, you're constantly putting foods in the body which are further driving more and more gut inflammation. So part of treating all this is trying to identify these intolerances and allergies, because you're just further contributing to gut dysbiosis and gut inflammation. Poor dental hygiene and microbial balance in the mouth is actually something that not a lot of people think about that can contribute to gut dysbiosis. I actually have that on my intake form now, because some people, I have worked with quite a few people who had very poor dental hygiene and were prone to a lot of infections in the mouth. And when we actually got them to go to the dentist and deal with all this, their health, there was a lot of other stuff to look at, but their health did dramatically improve. Medications, there's so many medications which can contribute to gut dysbiosis. For example, non-steroidal anti-inflammatory drugs, so like ibuprofen, negatively influence the gut microbiome. Some people are taking these daily and weekly. So I mean, yeah, if I work with a client who's regularly having to take non-steroidal anti-inflammatory drugs, again, it's another sign that on some level there's probably a level of gut dysbiosis going on there. Herbicides and pesticides are a major contributor to gut dysbiosis, so including glyphosate or Roundup, which is used on all these genetically modified crops. So the list goes on. It's huge. But I guess essentially, when you're thinking about what contributes to dysbiosis, we have a stressful modern lifestyle combined with an increase of environmental toxicity, combined with potentially in some people very poor dietary choices, medication and antibiotic overuse, inactivity and blood sugar imbalances, excess alcohol consumption. There might be a cesarean birth factor to consider. A certain level of a few or many more of these factors combined will progressively contribute to a level of gut dysbiosis. And combined with kind of gut inflammation, leaky gut will be the end result of this as well. So I guess considering all of that, you can hopefully see now why there are so many conditions that are kind of linked to leaky gut and increased intestinal permeability. You know, we're seeing a huge increase in autoimmunity, in food allergies and intolerances. In fact, Australia has one of the highest rates of food allergy and food intolerance, which is really interesting. I mean, babies are born these days where, you know, the mother may have had dysbiosis and have not had the greatest level of gut health. So, you know, and this gets passed on to their kids' gut microbiome if they had a natural vaginal birth. A lot of these kids are born with heavy metals and increased toxin loads and might have had a C-section delivery, might be brought up eating very highly inflammatory foods and formulas. All of this is just like the perfect storm for developing allergies, for developing intolerances, for having a dysregulated immune system. And there's some research to suggest now that this can set up the stage for metabolic issues in the future as well. So a lot of it really does come down to the health and integrity of our gut microbiome and the integrity of our gut wall. So if you have multiple symptoms or conditions and you have no idea where to start, one of the best pieces of advice I can give anyone is you have to start with the gut. Otherwise, you know, everything else will just kind of be a band-aid. And if you need help and don't get it, it's all overwhelming, just, you know, get help from someone who is knowledgeable in the area. So I'll also quickly mention a condition known as SIBO, which is called small intestinal bacterial overgrowth. This can also be a big kind of driver and exacerbator of leaky gut. And again, it's kind of, SIBO can develop in an individual after, you know, quite a long time of all the factors I mentioned previously. And, you know, these people develop dysbiosis, but I guess if it's quite bad, and depending on other factors, what can happen is these gut bacteria that I'm talking about, they should predominate in the colon or the large intestine. There's a small amount in the small intestine, but they're predominantly in the large intestine. But what can happen due to a variety of factors with SIBO is these bacteria in the large intestine kind of translocate and come up into the small intestine and kind of crowd out in there. And this can cause a whole range of issues because an overgrowth of the bacteria in the small intestine kind of directly damages this lining of the gut wall. which can eventuate or just exacerbate quite aggressively leaky gut. The bacteria in there that produce their own the LPS endotoxins, they damage the gut wall, and so we stop producing our own digestive enzymes. This is why one of the hallmark symptoms of SIBO is this kind of chronic, unresolved bloating. I've worked with a few people in the past who their gut was fine in all aspects and on all layers, but they had daily chronic bloating and had no idea from what and why, and it turned out that they had SIBO. So there's a very specialized testing and treatment to deal with this through a naturopath if you suspect you have SIBO, but this one is kind of tricky. It does need to be treated if it's there, because if you kind of ignore that and go in with other treatments, they'll just become a Band-Aid too. But so if you have this chronic unresolved bloating, definitely have SIBO on your radar and try and get that assessed and addressed. So I guess, my view about health in general is that there's certainly, well, obviously, from my perspective, an increased importance of ensuring our gut health and microbiome is in an as optimal state as possible. That we're nourishing our gut through diet and stress management, cleaning up the diet, cleaning up the lifestyle, and also ensuring that our detoxification organs are in an optimal state. So our bowels, our liver, our gallbladder, our kidneys are being nourished and supported. And some people, well, a lot of people I work with do need a bit of extra support, because although, yes, our organs are designed to naturally metabolize and detoxify toxins that are internally generated or from the environment, but with this ginormous increased environmental load, processed diet, poor dietary choices, chronic stress, all the extra amount of LPS endotoxin production going on with dysbiosis, this generally means all of this puts a huge load on our detoxification organs to get it out. So a lot of people really do need extra digestive and detoxification pathway support during all of this to, sure, for symptom relief, but to also prevent dysbiosis and leaky gut from developing or progressing. Which is why I think we're seeing such an increase in demand for complementary naturopathic, herbal nutritional medicine and targeted gut healing support. And I guess when I use the word detox, when I'm talking to clients about, we kind of need to support detoxification, I'm not talking about like kind of an extreme juice cleanse or whatever. I'm essentially more talking about and saying that due to this increased load on the body and these organs, the increased burden on these organs, if we have gut dysbiosis and digestive issues, a lot of people need extra support for these detoxification pathways. And I mean, testament to this is people walk into health food stores and buy, liver herbs or particular nutrients for liver detoxification support, or people buy probiotics and they go, it really quickly and obviously helped my allergies, or it helped my joint pain, or it got rid of my headaches, or, so there is certainly testament to it. But I guess also, if you take these and feel better, that's great. But if you stop taking them as well and then everything comes back, obviously there's something deeper going on, and that is usually gut dysbiosis and leaky gut. So I guess the million-dollar question is, how do you treat leaky gut? So I guess like any holistic approach to health, a treatment plan for leaky gut will differ from person to person. There's many different factors that could be going on, particularly if you get right into the specialized microbiome testing. But in general, there are a few factors to kind of consider and address across the board. So I guess you've got to remove any really obvious exacerbating factors. So this essentially means looking at your diet and lifestyle and cleaning it up and modifying it in a way that is in line with feeding a healthy gut microbiome. So, you've got to get rid of all these highly inflammatory foods, the processed vegetable oils and margarine, the, excess refined sugars and carbohydrates, the excessive alcohol. Processed meats are kind of not so great for the gut. Excessive dairy, getting into the habit of reducing your pesticide exposure, by buying organic where you can. But I mean, wherever you get your fruit and veg, soaking them in the kitchen sink with apple cider vinegar for 10 minutes does the trick really well. And I guess in here, I would also throw in terms of lifestyle support, ensuring you're getting good quality sleep. Kind of like ensuring the gut is healthy. Sleep is so important. A lot of people are, because when we sleep, we're healed. If we're not sleeping properly, we are kind of further contributing to that dysregulation of the stress hormone network, which is directly inflammatory to the gut. So a lot of people I work with aren't sleeping well. And so a starting point might be some gut support, but another priority at the very beginning is to get people sleeping properly. Because then they also have more energy, and then they can, have the kind of mental effort to kind of commit to changes and stuff as well. So I guess other exacerbating factors to remove to stop perpetuating this inflammatory cycle in the gut is to remove any existing food allergies and intolerances, because this is important, because when you've developed leaky gut and you have all of these food intolerances and or allergies, there's this vicious kind of circular relationship going on now with having a leaky and inflamed gut, because this inflammation that causes and exacerbates leaky gut, this makes you more susceptible to developing more food allergies and intolerances. Like a classic example is a lot of people I meet said, well, first I noticed I couldn't eat gluten. Then it was dairy, and then it was kind of just like that for a year, but then for whatever reason, within a few more months, they then started just reacting to all these different kinds of fruit and vegetables, and all the intolerances start to pile up, and then people get lost because they have no idea what they're reacting to anymore. So, and then having gut inflammation causes you to have more intolerances. Eating the foods that you're intolerant to drive more inflammation, and then this cycle just kind of perpetuates. So I guess that there are many different ways to go about, testing and treating food allergies and intolerances. And how do I find this out? I personally use something in my practice called food biocompatibility testing. It's a hair test that basically tests for foods which on a deep cellular level are driving inflammation. And I get awesome results with this. I also practice something called positive association technique, kinesiology, and acupressure. I practice this at the Natural Allergy Clinic in North Sydney. Both of these they're different, but they're both really valuable for not just quick symptom relief, but long-term resolution of gut issues, because we're getting rid of and treating the things that are perpetuating all the gut inflammation. Which one of these I use really depends on the person, depending on quite a number of factors. So just drop me comments or questions if you wanted to know any more about either of these. They're both fantastic for dealing with all the food intolerances. Learning how to take care of your adrenals and manage stress, again, I know, like, kind of cliche, but it is super important, like, because of everything I discussed before. So looking at sleep hygiene, some sort of breathwork practice, getting outdoors, getting your feet in the earth, daily sun exposure, all this stuff that we know we're meant to do, but we don't, because we project that we're too busy, or I guess we're actually we're not linking the value of these things to our health, but they're really important. So sleep hygiene and stress management and, scheduling nothing time and kind of nourishing ourselves is really important. So I guess on top of that, with the stress factor, a naturopath can really help you navigate chronic fatigue, stress, anxiety with herbal and nutritional adrenal support. And it's honestly an absolute lifesaver and a game changer for stress support because, you know, at the end of the day, we can optimize our environment as much as possible, but we can't always change our environment, whether that's our work or home place or a relationship or whatever. You know, there are certain factors we may not be able to change overnight and which cause us to endure stress. So a lot of these herbs and nutrients, whatever, this extra adrenal support can really, while you're trying to navigate life, can help reduce the effect of stress on the entire body and particularly the gut. So, you know, a lot of people I'm working with, I'd say 99% of people have some adrenal support. And so I guess to treat leaky gut more specifically, so from a naturopathic, a holistic, functional medicine perspective, we would be helping clients not only with everything I've just been talking about, but also recommending very specific prebiotic and probiotic dietary strategies that are in line with feeding a healthy gut microbiome, while also using different herbal medicines and nutritional medicines that are targeted at kind of healing and sealing this inflamed leaky gut, making it strong again. We would also focus on improving your digestive enzyme production and, you know, therefore your digestion and absorption of food. We're very focused on correcting this gut dysbiosis through very specific probiotic and prebiotic support. You know, this is super important. Yeah, and I guess, again, like I said before, a testament to this, some people don't even go in and work with a practitioner or get testing done. They just started taking probiotics or anti-inflammatory gut powders and they notice a significant improvement in their health. So to kind of dismiss leaky gut and, you know, the importance of gut microbiome health is kind of crazy. And I guess what is brilliant these days, because I mean, that's a kind of, that scenario would be nice if it happened for everyone, but it doesn't. A lot of people might try all this typical stuff and not notice any difference, or they might get worse. So what is brilliant these days is we do have access to very comprehensive stool testing, which measures the levels of all these different bacterial species, and they can get quite comprehensive in assessing for all the pathogenic, opportunistic pathogenic bacteria, the parasites, worms, viruses, so that we can not only prescribe pro and prebiotics to the individual, but there might be pathogenic bacteria, viruses, or overgrowths of certain species that we need to eradicate or get down. So we can get really specific with it now, while I guess also though, while maintaining a holistic approach to the person. So there are antimicrobial herbal medicines, which for a lot of people are quite important at dealing with dysbiosis. But I guess my caution with these is they're quite strong. And I guess in my own practice, I only recommend them and prescribe them when deemed absolutely necessary, particularly like herbal essential oils. Like they're really strong antibiotics, and you don't want to be taking these for long. They can have collateral damage on beneficial gut bacteria, but it is a part of treating dysbiosis. But I guess I would just navigate that carefully with the practitioner. So I do get asked a lot, you know, how can I test for leaky gut? Is there a test to see if I've got it? There isn't really any kind of gold standard for identifying leaky gut. I guess personally, the most important way to determine the likelihood of someone having leaky gut is honestly a clinical diagnosis based on a very thorough case-taking history by a holistic practitioner who can kind of discern the likelihood of leaky gut being a driver of someone's health condition or symptoms based on this really comprehensive case history and their understanding of all these factors that drive dysbiosis and finding that within someone's timeline and maybe be able to connect it to particular symptoms or manifestations in their health and their medication history and kind of all that stuff I was talking about before. There are some tests out there promoted, like one is called the lactulose mannitol test, which has been used for many years to apparently be able to determine someone's degree of leaky gut. But I guess upon research, there's just too many variable markers in this test. It isn't as reliable as we once thought. And, you know, at the end of the day, even if there is a test that tells you you have leaky gut, it doesn't tell you why. It's kind of similar to a urinary pyrroles test. That's great, but it doesn't tell you why. It's like being diagnosed with anxiety or IBS. It doesn't tell you why you have it. So I guess just in terms of prioritizing spending on testing, I guess essentially because gut dysbiosis can contribute to leaky gut and all this stuff, I personally combine a very comprehensive case history with comprehensive stool testing, because to treat leaky gut, you need to treat gut dysbiosis or any existing infections. So this would be my priority of testing. A stool test I do routinely use, which is called GI map. In the US, I think in Australia it's called complete microbiome mapping. This test does measure for levels of this zonulin protein I mentioned before. So that is a nice marker to look at to be able to kind of discern the potential degree of leaky gut someone has. And yeah, so this is the protein that kind of regulates these tight gap junctions in the gut wall. I've got to say that many clients I've had do the GI map with a lot of chronic inflammatory symptoms typically come back with zonulin through the roof. So it is nice to see that on paper and just kind of explain to people, look, it's kind of obvious it's going on with these symptoms, but it's also coming up in this test with this protein. So, you know, that is nice to see on paper. And, you know, if you're not in a financial position to invest in all the stool testing at present, but still want to kind of sort out your gut or inflammatory issues, this doesn't mean that you can't get help. You just need to be in the hands of a savvy practitioner who takes a really good thorough case history, is all over kind of gut health, gut microbiome health, the current research, because to be honest, a lot of GPs and gastroenterologists are not, and they're not interested. And, you know, someone who can, based on a really good case history, be able to determine a course of safe but effective treatments based on your unique presentation and what your most probable underlying drivers are. There's a lot that we can do without testing. You know, like I mentioned before, there's huge numbers of people that just kind of walk in, grab stuff and sort out their gut like that, with all these kind of basic foundational stuff. But also there's these people who've typically cleaned up their diet and lifestyle as well, managing stress. But, you know, I guess if you're someone or know someone who is kind of doing all the foundational stuff, you've tried probiotics, tried this, the leaky gut formula, that, but you're getting nowhere or you're getting worse, you may have SIBO. Or the next step then would be to invest in gut microbiome testing, because essentially, like, you're saving a huge amount of time and money because it's allowing you to get to the root cause. And when you treat what comes back, you can start to get off the bucket load of supplements, because when you're treating the gut, dealing with overgrowths, shifting the microbial balance back to a more positive one, you're absorbing your food, you start to sleep better, you've got more energy, your mood is starting to balance. And it really does all come back to treating leaky gut and dysbiosis. Not to get too reductionist or dogmatic about it, but it is a very big, important piece of a very complex puzzle that I would start there. But speaking of gut testing, there's another gut test, a microbiome test I use called uBiome. So it's spelled UBIOME. I'll just quickly bring this up because it is a separate stool test that doesn't really look so much at pathogens, but it's this kind of very accurate, sensitive, extensive blueprint of all the beneficial and some not so beneficial bacterial species in the gut that can really specifically allow us to target prebiotic, probiotic, and fiber supplements and foods to feed particular bacterial species and essentially treat dysbiosis. And it's actually a very cost-effective test. It is $89 US, but I still have, I checked today, there is a code I got months ago that still works, and it allows you to get this test half price. I just want to actually confirm that that's still the case, but I'm pretty confident. So yes, so I'll post a link to this stool test, the website called Ubiome, and I'll also punch the discount code. It's been up there for months. I honestly have no idea why it's still up there. Maybe they forgot. But so you can access this stool test for $45 US, so that is pretty cool. You do need someone to kind of book in, and it's kind of just raw data, so you do need to kind of work with someone who can help you analyze it. But yeah, that's it from me. So I hope this video was useful. And anyone watching the replay, please drop me a comment. Please say hi. Let me know your thoughts about leaky gut. And I'm going to do another live video soon, quite specifically on the gut microbiome and its potential implications in endometriosis. So watch out for that one. Have a good night, everyone in Australia. Stay warm. It's really cold. Bye.